Hello, this is Dr. Douglas Husbands. I'm an Institute for Functional Medicine certified practitioner, a doctor of chiropractic, and a certified clinical nutritionist. I've been in practice for over 28 years. Today, I want to talk to you about diagnosis of leaky gut. Now, in discussing this, I'm going to be discussing the in vivo measurement of leaky gut. In vivo means in live human beings. As opposed to dead human beings. No, but seriously. There's the other method where you can measure leaky gut in vitro, that is in test tube or in the laboratory. So we're talking about in vivo because this is practically what people are interested in, and this is what I see in clinical practice and have seen for over 28 years. The previous method for testing leaky gut, one of the best methods was the Lactulose Mannitol test. Lactulose is a large sugar molecule and mannitol is a smaller sugar molecule. So this test, what it did, you would drink this solution of lactulose and another solution of mannitol, and then there would be a measurement of what came out the other end, so to speak, and how quickly that came out and the level that came out. Now, because lactulose is a bigger sugar, then it could only get through the gut lining if it was there were bigger spaces, if it was more leaky. And the mannitol, since it's a small sugar, it could get through the leaky gut only if it was not, if it was, the junctions were tighter and there was less space. So that method of testing, which was good up until the work as a result of Dr. Alessio Fasano, where he went through the mechanisms of action and discovered that zonulin, which is a regulator of tight junctions in the intestinal lining, when the discovery with Dr. Fasano that zonulin is a very good indicator, it's actually a better indicator than the lactulose mannitol test. So the newer 21st century testing does confirm that zonulin is a better objective indicator of the level of leaky gut. The higher the zonulin level goes, the more indication of leaky gut that you have. Now, so from being in practice over 28 years, a lot of people come to see me who have various manifestations that the core cause of is leaky gut. And so I do a lot of stool testing, not in my office, but I give people a kit to take home to do it in the privacy of their own home, so that they can get a stool sample. And zonulin is a very, very good tool to use for objective assessment in leaky gut. And I've used it since it has been available since the early 2000s, and I find it very, very useful for pre-treatment assessment and after treatment assessment for objective measurement of the presence or absence or decrease of leaky gut. So let me also just mention about, as far as diagnosis, with various conditions, I see some significantly elevated levels of zonulin. That is, more people being more leaky, having more leaky gut. One of the highest I'd ever seen was in a patient who had autoimmune Graves' disease, and this young lady had a zonulin level of about 1400. You should have zonulin less than about 50, where that would be indicative of not having any significant leaky gut. But in this case of this person with autoimmune Graves' disease, that is autoimmune hyperthyroidism, a level of 1400 has shown up, and then we worked with her over a period of time, and gradually over about a 6-month period, we were able to get it down into the about 500, and then a couple months later got it down into the 300 range, but still high. Anyway, other conditions where I see very high zonulin levels are in skin conditions. As mentioned on a previous video, where skin conditions are obviously very much something that you can see, and that bring a lot of people into my office because of that. I very often see people with eczema and allergies manifested on the skin, having very high zonulin levels. So I hope this information has been helpful and interesting for you, and I appreciate you sharing it with others. And I look forward to sharing additional information with you on additional videos. Thank you. We're going to be talking about treatment of leaky gut in an upcoming video, and I hope you look for that and enjoy it. Take care. This is Dr. Douglas Husbands.